friends. I'm Dr. Gaurav Singh Bhandari, Director and Unit Head at Dharamshila Narayana Super Specialty Hospital, New Delhi. Today I'm going to talk about robotics in joint replacement surgery. But before that, I need to tell you something about what is a joint replacement surgery. People tend to ask us whether we cut the bones and what exactly we do in the joint replacement surgery. The important part is we do not cut bones and all, we just remove the damaged cartilaginous part of the bone or the capping of the bone or the covering of the bone. And in a way we prepare the bone so that a new knee, a new metal is capped over the prepared surface area. That's a crux of the joint replacement surgery. So coming to the topic of discussion today is robotics. People tend to ask in our OPD that what exactly is robotic joint replacement surgery, because you will be seeing a lot of advertisements and hoardings about robotics in almost all the field we have nowadays. It is not the robot which is important. Like you have n number of brands in cars, models in cars. So there are n number of robots also in the market for the joint replacement surgery. It is not the robot which is important in the surgery, but it is the surgeon who is standing behind that robot and actually driving that robot in helping the joint replacement surgery. Second thing, what is important here is there are 2-3 types of robots. One is fully autonomous robots, one is semi-autonomous robots. We at Dharamshila Narayana Hospital have got a fully autonomous robot. But again, the important aspect of this is it is the surgeon behind the robot or behind the machine who is driving the robot or the machine is important. The experience, everything is more important than the technology. Technology comes at a later part. People tend to say that how is it better than a conventional joint replacement surgery? As we all know, the conventional joint replacement surgeries are being performed since decades now, whereas the robotic joint replacement surgery is in the market for about 2 decades. So the answer to that question is definitely a new technology is always level up, a step up as compared to the conventional joint replacement surgery. So what exactly happens in a robotic joint replacement surgery? In this kind of surgery, a technology, a robot is an aid to the surgeon who helps the surgeon in executing the surgery with precision, with accuracy during the bone cuts and placement of the implants. So what the prerequisite is CT scan. The CT scan will give you a 3D model or the image of the knee. And based on that, the computer or the software will cap the knee based on a patient's profile, which size or which model is beneficial for the patient. Or basically it is tailoring of the knee joint according to the patient morphology. So how does this helps? The robotic joint replacement surgery helps in precision, accuracy of the bone preparation and implantation of the joint. The incision is usually smaller than a conventional joint replacement surgery. The patient who is on table and the surgeon who is operating upon the patient always have an aid, a tool which helps the doctor or the surgeon to tailor or to change the alignment based on the need of the patient on table during the surgery. Thus, it reduces the complication risk, it helps in better recovery, better functional results of the patient, a more aligned, a more tailored and a more patient-friendly joint the patient can use for the rest of his or her life. This personalized surgery helps in less of soft tissue dissection intraoperatively. Also, it helps in having a better implant survival ratio or the rate for the patient. And also in robotic joint replacement surgery, when a doctor or the surgeon is operating upon the patient, this robot gives a live feedback to the surgeon where exactly the surgeon has to stop, what exactly is happening inside the patient's knee, how much alignment or how much tissue tensioning or the tightening has to be done accordingly. That's why I said it's more of a personalized surgery. There's something else is coming into the field of joint replacement, in which we use artificial intelligence or augmented reality, in which the surgeon wears special glasses, and there's a special software which helps in giving a real-time navigation, real-time feedback to the surgeon, which helps in aligning the patient's knee. So there are a lot of researches and R&Ds happening in the field of robotics and joint replacement, thus helping the patients to restore normal life. Another thing which is important in robotics and joint replacement surgery is the basis, the basic. The surgeon needs to have his own basics. Of course, the learning curve is high, the learning curve is long, but the results are very fruitful to the patients as well as to the surgeons. So we at Dharamshila Narayana Super Specialty Hospital are doing the robotic joint replacement surgery on day-to-day basis. There are n number of companies which are providing this technology in the market now, and every implant is married to that same company. A implant and an A robot are married to each other. So it is not the robotic technology which is important. Like I said, it is not the implant, it is the surgeon behind the machine who is driving the robot to achieve a better outcome into the patient. So at the end, I would request you, in case you have any doubts regarding robotic joint replacement surgery or any kind of orthopedic issues, feel free to contact at Dharamshila Narayana Customer Care Corporate Call Center. Thank you so much.